Are you tired? Kulang ka na ba sa energy? O di kaya meron kang mga mood swings? Nagkaka-brain fog? O di kaya kulang ka sa sex drive? Is it really part of aging or is it something else that we can treat and manage? Welcome back again for another episode of Transform with yours truly, Dr. Alvin Jorge. This is a space where we talk openly not only about patient journeys and real-life experiences in their transformation, whether it be aesthetic, gender-affirming, or just to achieve general wellness. So here we aim to educate, empower, and create conversations that truly matter. So today, sa episode natin, I'm very excited to be joined by a fellow doctor and someone I deeply respect in the medical field. Joining us today is Dr. Adelbert Evangelista, a very well-known and a board-certified physician in the US where he also practices. Si Dr. Bert Evangelista, of course, homegrown yan sa University of Santo Tomas Faculty of Medicine and Surgery, but has been practicing ever since sa Yuma, Arizona in the USA. He has extensive experience in regenerative medicine and more specifically, he is an expert in bioidentical hormone therapy. And today, napakaswerte natin because we'll be debunking the myths and we'll be looking at the benefits of bioidentical hormone therapy. Okay ba sa atin to? So again, thank you so much, Bert, for joining us here in Transform.
Alvin, thank you so much for the more than gracious introduction. I'm glad to be here. And I'm glad that bioidentical hormones is a topic for today. Regenerative medicine, Alvin, is at the forefront of everything that's going on in medicine right now. For those who are more interested and very interested in looking at natural treatments, wellness treatments, anti-aging treatments, then you're in the right place. That's what we're going to share with you today.
Okay, very good. So, kailangan muna natin i-explain sa kanila what does bioidentical hormone therapy mean? Can you define this for us, Bert?
Yes. Okay. When we say bioidentical hormone replacement therapy, we're specifically referring to sex hormone replacement therapy. In men, the predominant sex hormone, of course, is testosterone. Right?
Correct.
And in women, believe it or not, it's not just estradiol. A lot of women are familiar with, and a lot of people are more familiar with, estradiol is the main female hormone. But in fact, when we talk about sex hormones in females, it is a combination of both testosterone, estradiol, and progesterone.
Mm-hmm.
Okay. When we talk about bioidentical hormone replacement therapy, the word itself, bioidentical, bio, plant-based,
Okay.
identical, right? These treatments that we've been using in the United States now for more than 30 years, right? We can say are almost 90% similar or maybe even more to the natural sex hormones in our body.
Okay. So, alam mo, when we talk about hormones, testosterone, estrogen, parang meron tayong konting fear on giving this. No? So, from perspective of someone who is not a specialist in this, we have certain concerns.
Yep.
Gaya ng sinasabi nila na pagka nagbigay ka ng ganitong hormones, there's an increased risk of, say for example, cancer. No? Na alam mo sa US meron nakalagay na black box na advice regarding hormones, right? But there are some changes now. And what is the difference between that kind of treatment and bioidentical hormone treatment?
Very unfortunate, So let's differentiate the hormones. So when we talk about pharmaceutical grade hormone therapy, let's refer to that as synthetic therapy.
Synthetic.
Synthetic.
Oh,
Okay. So that word synthetic. Unfortunately, pharmaceutical grade hormones are not just like a lot of other medications or treatments may plant-based component. Yeah. Pag sinabing synthetic, okay, the pharmaceutical grade hormones, right, are mixed with foreign substances that sometimes don't adhere or are dangerous to our body. from there came the perception that hormone replacement therapy is dangerous.
Yun,
Diba?
very common yan. Alam ng karamihan ng mga doktor na, parang hindi maganda yung ganyang treatment. Yes. So, how is this different?
Depending in the states, depending on which company manufactured them, right, the synthetic component of these hormones can be as much as 50%. That means that 50% is plant-based, 50% is synthetic or foreign substances to our body. Diba? The difference with that compared to bioidentical hormones is bioidentical hormones are more than 90% plant-based.
More than 90?
More than 90%. And and what they say is that it's the purest form of hormones similar to that natural hormones in our body.
How does it differ from these synthetic hormones in terms of the effect on the body when comparing it to these bioidentical hormones? So, say for example na lang, yung how long does yung synthetic hormones last in the body? And what form of is it administered? No? Is there a difference also?
Yeah. Predominantly, ang synthetic hormones are given in the oral form. We have oral estradiol.
Correct.
Right? Or the estrogen forms can be oral. They can be in the form of patches. Testosterone in the form of injectables, in the form of gels. Ang bioidentical hormones, they can also come in similar forms, in creams and in gels. But the predominant bioidentical hormone that they've been using in the United States right now, which has really gained a lot of traction, is the pellet therapy.
Pellet
so in
therapy.
The pellet form.
Okay.
Yeah.
So, tell us about this pellet therapy. How do you administer this pellet to the patients?
Yeah. So it is a calculated dosage for every patient. So it's a customized dosage, right? The pellet is actually implanted. So it's a minor surgical procedure where you're implanting the pellet into the fatty or the subcutaneous tissue, either the buttock cheek or sometimes in our flanks, which we also know as the love handles.
But basically putting it in the fatty layer of the body. So,
yes.
Why so? Ano bang effect nito as compared to, let's say, an injectable na inject mo tapos na?
So when we're treating patients with bioidentical hormone replacement therapy, the end goal is to have a optimum level for a sustained period of time. And that can only be achieved through the pellet implant. So when we go to that, we're looking at half-life of medications, right?
Yes.
So that's important. So when we do injectables, for example, testosterone injections, the regular dose is 200 milligrams per ml every 2 weeks, right? Therefore, the half-life of that medication at most is about 2 weeks on average. Right? It will maintain an elevated level and then eventually go down, and you have to repeat that treatment every 2 weeks.
So every 2 weeks, injection na ako. Ganon, if I need that.
Yeah. The superiority of the pellet therapy is when you put it in, you're able to maintain a elevated optimum level for for males, up to 5 to 6 months.
Wow.
In females, anywhere between every 3 to 4 months.
Wow, ang laki ng difference.
Big difference, compared to you're doing the treatment every day or every week.
And yung, let's say, yung serum levels of this one, is it more maintained with the pellet therapy since slow release siya? Parang ganon?
Yes. It stays in your system longer and acts like a time release treatment, but it's really not. It's actually based on metabolic rate. So when we put it in there, right, it will achieve a certain level. And of course, just like any other medication, eventually will fade off, like a time-release treatment, right, until you're due for your next dose.
Okay. So medyo mas matagal, ano? Mas matagal. Now, syempre importante, para sa akin ba itong treatment na to? So, sino ang mga pasyente that will benefit from pellet therapy with this bioidentical hormone therapy?
Yeah, that's a great question, Alvin. Believe it or not, anybody as early as 25 years old can start experiencing symptoms related to hormone deficiency.
Okay.
So even as early as 25 years old. So physiologically, everybody after the age of 25 will start losing sex hormone levels, right, at a certain rate. They say anywhere between 2% per year, give and take.
Okay.
Right? Give and take.
Uh-huh.
So if you start experiencing symptoms, low energy levels, sleep issues, mental clarity or brain fog,
Okay.
mood swings, predominantly in a person who's been generally been in good health, right? It's usually a sex hormone related issue, believe it or not.
Alam mo yung mga minention mo na mga symptoms are symptoms that I think a lot of people experience even in younger patients and more so with older patients kasi alam mo minsan sinasabi ng doktor sa mga pasyente pagkakulang na yung sex drive, meron ka ng mga mood swings. That's just part of your aging process. That's part of menopause, di ba? And a lot of women are suffering these symptoms when they undergo menopause. So, come to think of it, is it just because of the hormone level? And hindi ba tanggapin na lang, aging lang yon? Tama ba?
Unfortunately, 90% of the doctors, or more than 90% of the doctors, are going to be thinking in that realm.
Oo,
Yeah.
kasi, di ba? Oh, that's what we learned. No?
Tumatanda tayo. We start experiencing these symptoms. Right?
Oh.
You go see your regular doctor, your primary care doctor.
Uh-huh.
They do all the routine blood work. They do all the routine cancer screening and everything checks out perfect. Right? Sir, ma'am, everything looks good. All your blood work came back good. There's no evidence if you got any chronic illness. Right? This is all just part of your aging. Your metabolism is slowing down.
Yeah.
Right? Hey, doc, what can I do? What's the next step? You have to eat better. You have to sleep on time, exercise, lose weight, keep your stress levels down, and I'll see you next year.
So, more of advice, walang ginawa.
Right.
Yung doktor, ano?
My insomnia is really bad.
Oh,
Right? Hindi ako talaga makatulog.
correct.
Now we start going down the road of prescription pills. Right?
Oh,
Right.
okay.
Right.
So, with that,
But think about it. You've never had this problem when you were in your 20s, in your 30s. All of a sudden, you're in your middle age, you're in your 40s, and you start experiencing these symptoms. Right? I'm going to tell you this, Alvin. Studies have shown 99% of the time, when everything pans out okay, your labs are good, there's no evidence of chronic illness, guess what? It is hormone related, specifically sex hormone related.
and let's just say na nagpuntang pasyente sa doktor and then the doctor requests for these several lab workups. Kasama ba ang hormone sa mga request nila usually?
Hindi.
Patay. O hindi. Paano nila kayo malalaman, di ba?
And you know what? In the United States, there's actually a bias towards that. Okay? So when they order routine blood work, right, it's intentionally not part of the routine blood work.
That's my point. Yeah.
And why is that? Right? Number one, the perception of hormone treatment per se in the United States is negative. Right? They don't want to address it. Right? Not only are we not checking it at the same time, right? They don't want to address it or they don't know how to treat it. Because the available treatments that we have out there, right, are prescription hormone replacement therapy, which are known to have adverse side effects, dangerous side effects.
The synthetic
The
hormones.
synthetic ones, the pharmaceutical grade.
Okay, the pharmaceutical grade.
Yes.
Oh my goodness.
Yes. But what makes it dangerous again? What makes it dangerous is, remember, it's not the plant-based components. Majority of the medications have a plant-based component, right? It's the synthetic component that makes it dangerous. So, anong solution doon? Diba?
Tanggalin mo yung ano.
Kung pwede natin tanggalin ang synthetic component and make it predominantly plant-based and natural, right? Then that resolves one of the issues. It resolves the issue of having to worry about any adverse side effects.
So pag tinanggal mo yung synthetic part, you remove the one that causes the problems and that will now point into the bioidentical hormones. Fantastic. So
Exactly.
let's just say, okay, I have these symptoms. I want to improve my energy, sex drive, mood swings, etc., etc. Pagka nagpa-pellet therapy ako, what should I expect?
Okay. Great question. So remember what I said, right? If you're in your middle age and you start experiencing those symptoms and you've never had them before, 99% of the time it is sex hormone related.
Yes.
Right?
Huh?
Sex hormone related.
Okay.
You didn't have this in your 20s. You didn't have this in your 30s. You start having it in your late 30s, mid 40s, right? Wala tayong ligtas, Alvin. Every male and every female is going to experience at some point in time a rapid drop in their sex hormone levels. In women, that can start during a phase we call as perimenopause.
Correct.
Right?
Yes.
Perimenopause or menopause. Okay. In males, we go through that rapid decline in sex hormones, a phase we call andropause. During that particular phase in our lives, right, we are going to lose over a period of time as much as 70% of our remaining sex hormone levels, which science has confirmed attributes to worsening of symptoms plus higher incidence of disease.
Since you mentioned these improvements of symptoms, the chance of having different diseases, isn't this something that we usually look for na parang wonder drug that will treat all our medical problems, and somehow we have been looking at stem cell therapy, no? Na parang kung isipin mo, the benefits that you get with this bioidentical hormone therapy is somewhat what we're actually looking for with some other treatment, right?
The objectives are the same if you think about it, right? The objective for any treatment is number one, if we can use a natural treatment, right? Something that our body can take in with minimal adverse effects, that would be an ideal treatment, right? Number two, the treatment will provide symptom relief, right? And better quality of life. But the end point of all of this, all of these treatments, right, is to live longer.
Yes.
Have a better, right? Have a better quality of life and to live longer. Right?
Exactly the point of having stem cell therapy for a lot of people, di ba? So yun ang gusto nila, di ba? Since we're talking about hormones, now there might be some misconception to the public that, let's say, for women, estrogen ang meron ka. For men, testosterone ang meron ka. But technically, regardless if it's a man or a woman, female or male, you have both hormones, correct? And the level is just different. Now, with regards to the bioidentical hormone therapy, is there a dose-related difference also between men and women?
Yes, there are.
Oh.
Okay. But let me go back to some of the basics and the fundamentals of bioidentical hormone replacement therapy, so that they can understand what we talk about when we do levels and check levels or what are optimum levels. Okay, so bioidentical hormone replacement therapy, the whole goal of it is hormone optimization. Okay, and when we say hormone optimization, for the audience, I want you guys to be thinking at what level or at what particular point in time in our life did we have the best sex hormone levels. Actually, it was between the ages of 18 to 25, where the best hormone levels. Okay, they are linking in this science, bioidentical hormone replacement therapy. They are linking as much as 60% of your metabolism to your natural sex hormone levels.
During your younger age.
Yeah, during your younger. So, in short, a very common scenario that I can think of when we say optimum metabolism is whenever you eat whatever you want, right? You don't gain weight.
Nako.
Magandang metabolism mo.
Ayan ang maganda. Oo.
Yeah. So that was very ideal when we had the best sex hormone levels mainly between 18 and 25 years old. Think about it.
So, ibig mo sabihin, when we were young, di ba, nung bata tayo, kain tayo ng kain, kahit anong kainin natin, we never gain that weight, right?
Yeah.
But as we age,
Yeah.
we tend to gain more weight. And it's not really because of aging per se,
Yeah.
but more of the level of your hormones.
That's one of the points I'm trying to get to and emphasize with our audience.
Okay,
Yeah.
so ibig mo sabihin, pag ako nagpa-hormone pellet therapy, yung hindi lang magkaka-energy ako, I will also tend to lose my...
Yeah. Yeah.
What?
Regardless of age, your metabolism is going to get better. And over time, right, the way you process food, the way you process fatty food gets better.
Ayos.
Yeah.
So yung... so it has some weight loss effects.
It does.
In short.
It does.
Okay. Are there differences between benefits that we get between men and women? Are there particular benefits na particularly sa women na hindi nakikita sa lalaki, or is it the same? Well, I guess sa menopause wala namang andropause meron tayo.
Yeah.
But basically pareho din ba? We get the same effects?
So when men and women go through this rapid decline in sex hormones, whether it be perimenopause or menopause, or in males, andropause, right? The symptoms are almost the same, right?
Okay.
Except for, of course, in women, right, who have estrogen or estradiol, right? The main symptoms associated with that would be hot flashes, vaginal dryness, right? And sometimes decrease in sex drive. Ang men naman, walang hot flashes, walang
Yes.
dryness.
Correct.
Diba?
Correct.
So ang testosterone is mainly improvement of other symptoms: energy, sleep quality, mood, mental clarity, sex drive.
I do a lot of on a different topic. I do a lot of gender-affirming procedures. I do sex reassignment surgery, gender-affirming top surgery for trans men, and trans men in particular. They do have regular hormone treatment or hormone replacement, gender-affirming hormone treatment. Now, I would like to think that the way they do things is yung synthetic hormones, right?
Yes.
They do the injections every 2 weeks.
Yes.
And for someone who lives as a trans man, medyo he'll be doing this for his lifetime. Tama ba? Now, can they do this bioidentical hormone treatment? And would you think this would be better for them?
Those are two questions. Number one, can they do it? Yes.
Uh-huh.
Number one, would it probably be better for them? Yes, also. Why? Regardless of sex, right? We all need sex hormones. Regardless of whether you're a male or a female, we all need sex hormones, right? They contribute to a healthier metabolism, and what I forgot to mention earlier is a stronger immune system. And I'll get back to that. And I'll get back to that in a bit, right? That's number one, right? Number two, the methodology, right? Bioidentical hormones, when we put them in there, it's not only safer, right, but you maintain optimum levels for a longer period of time, right? So there are actually long-term health benefits that they can get from it as they maintain a level or an optimum level for a longer period of time.
Now, you mentioned yung synthetic hormones have some deleterious effects to us. And for someone who'll be taking this for his lifetime, he'll have the same problems.
Yes.
So, would this be a better option for them? Kasi nga, hindi nila alam. Even I don't know that we can actually do this for trans men. Is this something that they can avail of already?
Well, right now, the use of bioidentical hormones for trans men or trans women is still in the investigational trials. I actually am one of the first physicians to start engaging and experimenting on these and being part of these trials. Right? Is it doable? Yes.
So you've started already. Okay. So Of course, we know that you practice in the US, but you've been doing treatments here in Manila as well. Can they also go to you for this treatment?
Absolutely.
Okay. Thinking about the difference between bioidentical and yung synthetic, I think everything points to a more safer option here for bioidentical. And I wouldn't exactly experimental because you've done patients genetically male and female. The only difference is that these are now trans men who are living as males and are now requiring a higher hormone level of testosterone.
I say experimental because we are now using it in that population, in this special population. But with regards to the clinical outcomes that we've already been using and have tested through years in males and females, it all leads towards the positive. So we have positive outcomes with regards to decreased incidence of disease, positive outcomes with regards to symptom improvement. We have all of that data already.
Oh, so yeah. So I think the word experiment there becomes less significant since technically it's been used in men and women. And is there a difference with regards to treatment of phenotypical males from trans men in terms of dosage? They also need the same amount of dosage as cis males from trans men. Tama ba?
Well, let's put it this way. Do they need that same dosage that a male would get? No.
Okay.
They don't. Yeah. We can achieve a certain level, not as high as that, wherein we can get virilization manifestation without having to go to the extreme high level or the high level that actual males get.
Not as high, ano?
Not as high.
But definitely higher than cis women.
Yes.
Okay. A very important part to tackle here are the side effects. For medications, regardless, all medications may have some side effects. What side effects are we expecting here? And is it something that's commonly seen? And can we actually avoid these problems?
Yes. So some of the side effects that we would encounter, it's as much as 7 up to 10% of men who are undergoing bioidentical hormone testosterone replacement therapy. We still have to watch out for two things mainly. Number one would be serious side effects would be something called erythrocytosis,
Yes,
which is
the increase of hemoglobin.
increase of your hemoglobin and red blood cell count. We have to watch out for that. And then number two, the conversion of testosterone to estradiol. So that's a specific aromatase pathway wherein testosterone will convert to estradiol. And of course, we don't want, for men, there's really no benefit to have elevated estradiol levels. We don't need that.
So, in simple terms, ang testosterone na binibigyan natin, pwede pa rin ma-convert into a female hormone.
Yes.
Okay. So, how do we manage that?
Well, that can be managed in two ways. Number one, frequent blood level checking is important, right? Because if you give too much testosterone and it converts to estradiol, then all we need to do with the next treatment is just adjust the dose, right? When it actually does occur and the patient is symptomatic with any symptoms related to elevated estrogen, so say the male that we treated starts experiencing nipple sensitivity or breast tenderness or becomes more emotional, right? Then we would attribute that to the elevation in estradiol level.
Okay.
What can we do with that? There's actually medications that we use that targets estradiol levels in men. It's a very common actually hormone blocking therapy that we use in cancer patients, right? We've heard that. One of them is called Arimidex.
Okay.
So Arimidex specifically blocks or lowers estrogen levels.
Sa ano naman, effects on male hormones, I mean testosterone, because I see a lot of my trans men patients na they develop a lot of acne, no, on their body and ano. Does this also happen with the bioidentical?
Yes, it can. We call it a minor side effect because it's really just related to either the level goes too high or if the patient is very sensitive to the testosterone. So those are the two possible etiologies as to why that can occur. So the minor side effects that we watch out for, of course, would be number one, development of acne, right? That can happen. And if the patient is sensitive to the testosterone, it does affect a phase of development of hair, the telophase. The telophase phase of hair development can cause thinning of hair.
Oh,
Yes,
okay.
it can cause that.
But dose related, as long as it's managed.
Dose related and temporary, as long as it's managed. So it usually doesn't. Yeah,
Temporary.
it usually doesn't occur with the first dose. So sometimes it doesn't occur. It usually doesn't occur with the first dose, but over time, right? If the patient is sensitive to the testosterone or the level is too high, there's a higher chance that it can occur.
Okay, so watching out for your levels.
Very
That
important.
means you're having some regular workups done. So now moving there, how do you prepare for this hormone therapy? Can I just go to you, Doc? Doc, I want to have treatment. Okay, sige, go. Let's do the pellet therapy. Or do we do some workups? And what are those, if ever?
Well, ideally, it would always be great when we're treating patients to have a face-to-face consultation because every person is different. I want to look at what is the medical history we're dealing with. What are the medical problems that we have? Number two, what are the symptoms you're having? Are they really hormone related or not? Right? And of course, just like anything else, before we treat, it would be ideal to have some baseline blood work done.
Blood work.
Blood
Okay.
work done. We'd like to see where you're at right now with your testosterone levels. And of course, testosterone levels differ as we age. Right? So where are you at? Are you in the optimum level for your age? Are you in a suboptimum level for your age? That gives us idea where you're at and whether your symptoms are related to that or not.
Aside from that, kasi let's just say you have this certain hormone level, pareho tayo ng hormone level, but I'm a gym rat.
Sure.
And you're a gym rat and I just stay in the clinic, I don't exercise. Would there be a difference in how you'll manage me?
I'd like to say this, everyone is different.
Uh-huh.
There's no two people that are alike.
Okay.
That's genetically, that's lifestyle, all of the above. So, although we have a certain goal number that we're trying to reach, the treatment we actually customize based on your makeup. When I say your makeup, are you a high testosterone dependent male? Or are you a highly testosterone dependent male? And when I say that, you can just tell by looking at someone. What are their characteristics? Usually men who are very high in testosterone levels, deep voice, hairy, thick-boned, muscular, very athletic, especially when they were young. Those are what we define in the clinical scenario of a high testosterone male.
I see.
Those men typically will require a higher level compared to someone who is not of those traits.
Oh,
Yeah.
okay. So, ano pala, no? There are
So it-
telltale signs if you have a high hormone
Yeah,
level.
never high level. Yep.
Pag mababa, kailangan pala babaan ko yung boses ko para mas maisipin nila marami akong testosterone. But anyway, we've talked a lot about bioidentical hormone therapy and, it seems really promising. And there's a distinct difference. What I noticed lang between bioidentical hormone therapy wherein you get all these benefits. But it's something that a lot of people look at when they want to have this stem cell therapy. And somehow, the big difference that I see here is that with this bioidentical hormone therapy, there's a sound basis on how you do treatment as compared to a stem cell therapy that, okay, I want stem cell therapy. Okay, sige, come. What is your weight? What is your ganon? Usually, ang gamot, hindi ba based on weight, di ba? So, depending on weight per milligram per kilogram, sa bata, ganon din eh, di ba? But this one is a little more technical and there is sound science to how you're doing things. So, very, very interesting. And I think a lot of people who are suffering from all these symptoms of fatigue, brain fog, menopause symptoms, yung decrease in sex drive. So, imbis na uminom sila ng gamot, I mean, this will technically treat a lot of their problems, right? So for maybe for a final message, Bert, maybe you can tell our audience the benefits of hormone therapy. Who are the people who would benefit this the most, and maybe how to get to you.
Well, I'd like to emphasize the people who predominantly have these symptoms are usually in their middle age. So they're the people who will usually benefit the most from this. But can anyone age 25 years old and above get this? Absolutely.
25 up.
25 years old and above, you can get this,
Okay.
right? You may have symptoms that are not purely medical. They may be hormone related. Therefore, you are a candidate for bioidentical hormone replacement therapy. You know, we have to get away from the concept that pharmaceutical drugs or prescription medications are the way to go, right? Because we've been stuck in a world wherein when you have the symptom and the symptoms are severe or debilitating and affecting your quality of life, the answer is the pill, is a prescription pill.
Correct.
Right? We want to shy away from that. I always tell my patients, right, the best medicine, in fact, is no medicine. The best medicine is no medicine. Right? When we're giving a prescription pill, right, are we actually treating the root cause, or are we just giving or putting a Band-Aid on the disease? And the answer to that is we're actually just putting a Band-Aid on the disease. For example, and I've been in practice in medicine now for 20 years. If you're a diabetic, okay, and you've done everything that you can, you're eating healthy, you're exercising, you're losing weight, right? And we can't seem to get your diabetes under control, right? Then, by obligation, as a medical doctor, is I will prescribe you something to get that diabetes under control, right? But think about it. As we age, as our metabolism slows down, as the defense systems of our bodies weaken, right? What happens to the diabetes? The diabetes, as we get older, will eventually progress. That one pill will not keep it under control. Thus, we have a second family of pills and a third family of pills, right? Different mechanisms of actions. And the endpoint, as proven, is that as much as 60% of patients who are diabetic will eventually, at some point in time, end up on insulin. Right? I want you to be thinking outside of the box now. Instead of putting a Band-Aid treatment, if we can do something to alter the disease progression by improving your metabolism and improving your immune system, like that of when you were 20 years old or 25 years old and you didn't have to worry about any of those, then that would be an ideal treatment. That's one of the things, or a few of the things, that bioidentical hormone replacement therapy offers. Instead of treating the disease with a Band-Aid treatment, why don't we treat it at its core? When you were young, when you were 20 years old, and you had optimum sex hormone levels, and the science is saying that your sex hormone levels attributed to as much as 60% of your metabolism and your immune system, right? Then, if we bring those levels back to those levels, optimum levels, when you're at that age, right? The science has no boundaries. There's nothing in the books that says you're 50 years old and you can't have a sex hormone level of a 20-year-old. There's nothing. So if we bring it back to that level, right, doesn't matter what your age is, your metabolism and your immune system will try to act like a younger person. Over time, you start feeling better, you start feeling like a younger person. Over time, your metabolism and your immune system is trying to act like a younger person, right? And if we correlate that into the whole spectrum of, or the spectrum of regenerative medicine and life-changing or life-prolonging treatments, right? If you have a better metabolism and a stronger immune system, right? Number one, you have a better quality of life. Number two, you're less sick. If you're less sick, right, that equates to, over time, longer life.
Well said. Bert. And, it's quite interesting that with all this development, it's not yet here in the Philippines. And the good thing is that you are now here. You can now treat the Filipino people with this bioidentical hormone therapy. It seems to be a very promising treatment for not only wellness but in preventing problems and preventing us from lessening the taking of these medications and pills. Na come to think of it, we just need to manage our hormones and that's it. No? So anyway, thank you so much, Bert, for being here with us and sharing your expertise here in Transform. And we've learned a lot. I've learned a lot with regards to bioidentical hormone therapy. And of course, here in Transform, our goal is really to create a safe, informed, and compassionate space where stories are heard, identities are respected, medical information is shared responsibly, and we have here the expert of bioidentical hormone therapy. We can now stop bandaging and just remember that age is now just a number. And we can definitely manage that with bioidentical therapy so that we can transform to a better you. Thank you very much and see you in the next episode. Thank you, Bert.
Alvin, thanks for having me.
Thank you.